Hi all. My name is Jessica. This is an interview section with a respiratory specialist, Miss Susan Jacob. Hello Miss Susan. Hey. How much importance is there for respiratory medicine? That is a good question. Respiratory medicine has great importance in our day-to-day life as people are living in hectic life and majority of us are allergic to pollutants, dust particles. So we all should know about respiratory medicine. The respiratory specialist can diagnose and treat conditions affecting the respiratory system. That is diseases in the nose, throat, larynx, trachea or windpipe, lungs and diaphragm. I see. Miss Susan, what is meant by COPD? COPD stands for chronic obstructive pulmonary disease. This is a kind of respiratory disease. What are the symptoms of this disease? The major symptoms include shortness of breath, wheezing and chronic cough. Cough makes it harder to breathe. Symptoms may be mild at first, beginning with intermittent cough and shortness of breath. Later symptoms become more constant and becomes increasingly difficult to breathe. Patients experiences wheezing and tightness in the chest or have excess sputum production. Oh, I see. How we can recognize this disease? It is quite difficult in the initial stage because of that people are mistaken this to common cold during initial times. Later, due to more damaged lung, they will experience wheezing after even mild exercises. Feels uneasiness while breathing and feels lacking their energy. What is the cause for this disease, doctor? The single biggest cause of COPD is cigarette smoking. More than 90% of people who have COPD are smokers or former smokers. For long-term smokers, around 20 to 40% will become COPD patients. Many others will affect due to any of the lung conditions. The risk of this disease is greater if those who have asthma and smoke. Tell me about its diagnostic measures. Diagnostic measures include physical examination, CT scan, X-ray, through spirometry test and through arterial blood sampling. Doctor, in your medical practice mostly this kind of disease persons are young or old? Mostly above 40 years and persons who used to smoke more than 30 years. What are the treatment options? We can control this disease by oral steroids and with bronchodilators. What is purpose of using inhalers? Inhalers are used for patients with breathing issues to get fast relief. What is the difference between inhaler and nebulizer? Inhaler is a little device that can fit in our hand and are small enough to carry in a backpack, purse, or pocket. There are two types of inhalers. Meter-dose inhalers, MDI, are the most commonly used. Like little aerosol cans, these inhalers push out a spray of medicine. Dry powder inhalers deliver medicine in powder form, but it does not spray out. The person must do more of the work by inhaling the powdered medicine quickly and deeply. All right. Tell me more about inhalers. Dry powder inhalers can be a little easier to use than meter-dose inhalers, which are sometimes tricky. With practice, kids get very good at using them, though. The best way to use MD properly is by using it with a spacer. Most people are surprised to learn that the food they eat may affect their breathing. There is no specific diet for COPD, but a healthy diet is important for maintaining overall health. The stronger you are, the more able you'll be to prevent complications and other health problems. Thank you, Miss Susan Thomas. You are welcome. Please like, share and subscribe our channel for getting more new videos. Please comment your suggestions also.